Our mission as Progressive Health Center, we are a nonprofit organization dedicated to the optimization of good health care in the community, which means bridging the gap between traditional and non-traditional medicine.
As doctors, we're supposed to educate our patients. Docere comes from Latin, meaning teacher. And so we really need to teach our patients all these tools to give them to continue on with a productive, fulfilling life.
Approach is particularly important in my practice because I take care of people who have cancer. So oncology is very, very important. You have to understand, cancer is a very complicated disease. It takes a lot of specialty and expertise. But more importantly, the patient has to be very much involved. Think about it. It's very difficult to have surgery. It's very hard to have chemotherapy. It's very difficult to tolerate the treatments if you're not healthy.
Alternative medicine or non-traditional medicine includes things like exercise, nutrition, stress management, massage, acupuncture, energy medicine are all forms of non-traditional forms of services or treatments that could benefit all of us.
When I was off of chemo and the surgeon said, "Go get strong," my daughter and I would go for 20-mile bike rides. I've gone to acupuncture to help with the tingling in my fingers and my toes, and that's hard to quantify, but I swear it's getting better. And even at the cancer center, they said, wow, usually it takes a year to regrow nerves, and you're showing that after 6 months.
Today is my 1-year anniversary since I was diagnosed. During the last year, I've undergone an amazing amount of treatment. And I would say that for me, from the very get-go, understanding how to combine Western medicine and all of the best that we have to offer with that, along with more of a integrative approach was very, very important. And I'm so grateful that I found you guys in Progressive Health.
I would say be open to both Eastern and Western, be open to alternative therapies and things you can do, because you can, so much is out of your control, but a lot is in your control.
I've often looked at this cancer journey as sort of like Dorothy in The Wizard of Oz. And a storm comes in that you don't expect at all, and it takes you places that you never dreamt that you would go, and it brings people to you that you never thought.
My intent with partnering with hospitals was so that we could really provide services for the whole person, because traditional medicine does an awesome job of serving people who have to have surgery, things like that. But there's also the physical, mental, emotional, and spiritual components of each and every one of us.
And so I think that an integrative approach is essential. To treat any ailment in medicine, you really got to look at the whole person and all the factors that are playing into that illness or that problem.
I am so excited as the CEO of Pres St. Luke's and the Rocky Mountain Hospital for Children to be kicking off what I think is the next jewel in our crown, and that is to have integrative medicine. We have a new partner, Progressive Health, and they're impacting our community, our employees, and our patients in so many important ways.
I think the good news about today is that physicians are understanding that we can be a benefit to their patients, and we're receiving a lot more referrals or abilities to partner with conventional medicine because they realize that they can't do everything for their patients.
I would hope one day that prescription pad gets filled with things other than a test or a drug. I would love for that new prescription pad to include some really healthy alternatives, the resources that Progressive Health brings us, those classes, that perspective on how to live a positive life, how to count our blessings, how to take good care of ourselves. So that would be my vision for the future.
I think the hardest part is that financially there's not support for these services, especially for uninsured and underserved clients, patients. We have insurance for drugs and medication, but most people have to pay out of pocket for our services, such as massage or acupuncture, nutrition, stress management. And they're not very expensive, but sometimes people get in a situation where they can't afford these kinds of services, but they can be so beneficial.
I can't imagine having been through what I've been through without it. The programs where I can meet other people going through a similar experience or having gone through it.
One of the other projects we've started is a scholarship program for cancer patients, and it allows patients to come in for these kinds of services using a copay if they qualify, and it helps and allows them to really benefit from acupuncture, massage, nutrition. They go and talk to our integrative care coordinator to determine the best game plan for them, so that then they can receive these services during and after treatment. And our outcomes are really they're showing that we are showing good outcomes with these patients. I'm thankful for the community and people's awareness that today there are options in healthcare, and we're with us having the ability to empower people to really take responsibility for their health is so important.